Welcome to the new Westside Family Health Center. We worked so hard to get here, and I'm so excited to show you our brand new state-of-the-art clinic. Why don't we start at our entrance? As you walk into our lobby, you see we have screeners. They'll be screening patients before they come into our clinic for cough, fever, and shortness of breath, and any other coronavirus symptoms. One of the other things we do as a precautionary measure is that we call the patients the day before to see if they have any symptoms. If they are asymptomatic, then we're good to go. We have a phone number that we use to have patients call in case they are having any symptoms and they're concerned. So we do a lot of education around that. As everyone knows, there's a lot of education on hand washing, social distancing, and if they're feeling sick, we have people self-quarantine themselves. Let's head back into our waiting room where I first met you guys. Welcome back to our waiting room. As you can see, we have caution tape set up in the chairs to keep patients safe and to practice social distancing standards. As you can see on my right, we have 4 sections for our front desk staff to check you in, answer any questions you may have, and help you fill out any paperwork. We actually have one of our front desk staff here. Hi, Maricela.
Hello.
Good to see you. So this space creates a nice, open, and comfortable environment so that patients can relax before they get their room ready for their visit. One of the really neat things that we have here is our pediatric play area that our pediatric patients can wait while the community health worker comes and gets them ready for the visit.
Hi everybody, my name is Julie Kirk and I'm the Director of Community Outreach and Education here at Westside Family Health Center. I'm standing here in our amazing new conference room, which in the future is going to be used for our childbirth preparation classes. So fun fact about me, I've worked at WFHC for 21 years now, and I became a childbirth educator and a breastfeeding educator right after my son was born. So it's been about 17 years now that I've been teaching. In terms of breastfeeding education, really what we're doing right now is we're doing Zoom sessions, or sessions via Zoom, and then we're also providing folks with socially distanced sessions as well if they do feel like they need to come to the clinic. If it's a situation that needs to be referred to an international board certified lactation consultant, then we will refer those people to WIC. And just in terms of our childbirth preparation classes, we are also doing sessions via Zoom right now. But like I said, in the future, we cannot wait to use this facility for more of our classes and trainings. I'm sitting here with Connie Lopez because she is one of our community health workers that works in our prenatal program. And I know that we are a federally qualified health center that's been around since 1974, but one thing that's really unique about Westside Family Health Center is that we just moved to this beautiful new building. So not only did we move in April, but we're also providing services in the midst of a global pandemic. So Connie, can you tell me a little bit about what's unique about our prenatal care services?
Sure. So our prenatal care services, they're provided by nurse midwives, and a lot of times our patients can actually deliver their babies with the nurse midwives at California Hospital. So that is great for our patients because they get to see a friendly face, someone they've gone through their prenatal care with.
That's a great point because I love that continuity, and I also love the fact that we've always worked with certified midwives and the fact that what they represent is a low level of intervention.
Right.
Folks are not going to get like an unnecessary C-section because that's just not within their scope of practice.
Right.
And so I know that a lot of people actually seek us out because we do work with certified nurse midwives.
Mm-hmm.
Connie, can you tell me how people get referred to the prenatal program?
Yeah, all the patient needs to do is call in to our clinic, and they are screened to see if they already have Medi-Cal. If they don't have Medi-Cal, we can offer assistance in registering them for emergency Medi-Cal, the presumptive eligibility.
And the cool thing about that is that everybody that qualifies for that program is eligible regardless of their immigration status, right? Okay. And then we also provide, for people that don't qualify for Medi-Cal, covered California plans.
Right, exactly.
Okay. what is different now during COVID in terms of the types of visits that we're offering?
Patients, when they begin their prenatal care with us, usually within the first 28 weeks of their pregnancy, they're coming in every 4 weeks. So with now with COVID, we're doing every 4 weeks, either telephonic or in person, depending on what their necessity is. If they need to have labs done, then they're coming in. If they don't need anything done, then we could just do a telephone call. And if a patient just wants to come in, if they choose to come in, then we will make an appointment for them to come in. But otherwise, it's over the telephone or coming in if they need to.
And then one other thing, I know I said that was the last question, but there's also another program through CPSP that you provide additional counseling on nutrition and
So the
health.
CPSP program is the Comprehensive Perinatal Services Program, and we discuss with the patient nutrition and their emotional, physical health, and we just go over everything that they're doing, they're eating, and just help them in any way that we can. If they need any emotional support like therapy, then we will refer them. We can refer them to WIC so that they could receive nutritional benefits. So it just depends on each patient's need at the time.
Thanks, Connie.
You're welcome.